Thanks for joining the discussion today. We'll be taking a look at our second lecture, the human body and orientation. So within this discussion, what we're interested in looking at is starting to expand our vernacular of terminology and creating some baselines for the commonalities that we see within the study of anatomy and physiology to help us just be better at communicating within it. We first start out this discussion and we will consistently come back to this topic of anatomical position. So if you were to stand up right now where you are and face your palms forward with your feet slightly apart, you would be in anatomical position. So the importance of anatomical position is that we will always reference anatomical position for our anterior and posterior discussion. So even if a hand or an arm is pronated or supinated, we'll take a look at the origin of the muscles involved for that movement, for instance, and say that even though the hand is pronated, the muscles within this flexor group that are anterior are always anterior, even though at some points we might be laying on our stomach or laying on our back. If we're on our spine, we're supine. If we're laying on our stomach, we're prone. So the body can be in lots of different positions within space, but we always come back to anatomical position to reference the points that we'll be taking a look at directionally. Some of the terms that we'll be coming up with, you'll be learning a lot of these terms as we go forward. And just through the study of the skeleton, you'll have a lot of these terms show up. And then also when you study the muscular system, you'll have these show up again. So for instance, structure on the scapula is the acromion. So this is an acromial region. If we take a look at the thumb, it has a special name, pollex. So pollex is the name that we call the thumb. Halix is the name that we call the big toe. We'll see a lot of muscles that relate to the pollex or to the thumb as pollecis. And so we'll see flexors and extensors of the thumb. So flexor pollecis, extensor pollecis. In the big toe, we'll see muscles that are hallucis. So we'll see extensor hallucis, flexor hallucis. So a lot of these terms will show up and you'll get more familiar with them as we move on. Just these regional concepts that you want to be comfortable with. Each of our fingers is a digit, so this is a digital region. Our pinky incidentally has a name, digiti minimi, so it's the little digit, digiti minimi. Some of the orientation and directional terms that we take a look at, superior or cranial towards the head. If we look at inferior or caudal towards the tail, cauda is tail. And so if we're traveling toward the head, we're superior. If we're traveling toward the feet in direction, then we're going to be caudal. Ventral and dorsal. I always remember dorsal is like the dorsal fin on a shark. So that's posterior, and ventral is then anterior. So if we're moving toward ventral or toward dorsal, we're moving in those directions. Medial, lateral, and intermediate all relate to the very midline of the body. If we're headed towards that midline, we're considering the direction to be medial. If we're heading away from that midline, we're considering it to be lateral, and anything that would be in between is intermediate. In all of these discussions, whether it's superior, inferior, medial, lateral, we're talking about two items that are being related. So something is medial to something else. Something is lateral to something else. Something is superior to something else. So my nose is superior to my chin. My nose is medial to my eye. My eye is lateral to my nose. So just these directional terms, you'll always have two different things that we're comparing. Proximal and distal are terms that are reserved for the arms and legs. So when we see proximal, we think about the connection where an arm connects into what we'll come to know as the axial skeleton, the core of the body. Where that arm or leg attaches to the body is most proximal. The furthest point away, out at a tip of a finger or a tip of a toe, is distal. And so this conversation is relational too. So even within our hands, we have a distal digit or we have a distal phalange and we have a proximal phalange. We also have this middle or medial phalange. So in relation then, the distal phalange is distal to the proximal phalange. The first digit is actually, or second digit is actually a distal digit from the carpals that are the bones in the wrist. The carpals are proximal to this digit. So proximal, we're closer to the connection into the core of the body. Distal, we're further away from that origin. Superficial and deep really help us out with muscles. So if I think about pectoralis major, that's a very superficial muscle. It's close to the surface of the body. If I reflect pectoralis major, and I see pectoralis minor deep to it, pectoralis minor is deep, pectoralis major is superficial. And so we have this discussion term that allows us to go into and out of the body in different levels. So if we're closer to the surface, we're superficial. If we're further away from the surface, we're going to be deep. So within this then, two major divisions of the body, axial and appendicular. So axial includes the skull, the vertebra, the ribs, sternum, and the sacrum. Everything else that's attached onto those items is going to be appendicular. Incidentally, for the axial skeleton, thinking about the vertebra, an easy memorization technique is that if we have breakfast at 7, we have 7 cervical vertebra. We have lunch at noon, we have 12 thoracic vertebra, and then we have dinner at 5 for our 5 lumbar vertebra. So just kind of an easy memorization thing there. 7, 12, 5, breakfast, lunch, dinner for cervical, thoracic, and lumbar. And then again, these regional terms that we saw a little bit before help to designate specific areas. So anteriorly, we'll see these items. Posteriorly, we'll see these. And so again, you've just learned the cervical vertebra that we have 7 of them, the thoracic vertebra that we have 12, and the lumbar vertebra that we have 5, and then we have the sacrum. So those also become regional terms that we can use. Body planes are really related to how our bodies are sectioned when we usually have some kind of an imaging technique deployed within our bodies. So I think that these are easiest to see with this image. So if we have a frontal section that cuts us from the front to the back, like dropping this sheet of glass through us from front to back, then if we have a transverse section, as if this sheet of glass passes through us, moving from, say the top of our head all the way down to our toes, just slicing through, that's transverse or horizontal. And then if we have a sagittal section, and if we're in the exact center, we're median. So you've heard medial is toward the midline. Median with an N is the midline. So if we're exactly on the midline, split in half, we would have a mid-sagittal section. If we're off that midline, we would be parasagittal, or in many cases, you'll just hear of that as sagittal. And so these are the planes that cut through the body. And in most cases, these planes are helping us to understand imaging of the body that has to occur in order to many times create a diagnostic for some kind of condition that exists. There is some variability among all of us, of course, but anatomically that variability is only about 10% difference from person to person. 90% of all anatomical structures are going to match textbook descriptions, but some are a little different. And mainly within vasculature, we may see vessels that exist in some of us that don't in others. And we would never know that. We would live an entire life and just have these different vessels. It's no problem. We might have small muscles that are missing. So if you try to, say, palm a basketball and see if a tendon pops out in the center of your hand or in your wrist, then that tendon is for palmaris longus. 10% of the population doesn't have palmaris longus. It doesn't really stop them from doing anything. It helps with flexion of the wrist. But if you're missing it, you probably wouldn't even know it. but these are some of the things that give us some of this anatomical variability. This moves us into the concept of body cavities, and again, I think that these are most helpful with images. We have this dorsal body cavity, which includes the cranial and the vertebral cavity. So what's stored in here would be the brain and the spinal cord, and that entirety is the dorsal body cavity. And then we have the ventral body cavity, which is anterior, and it's broken up into a thoracic, abdominal, and pelvic. The really cool thing about these cavities is that they help keep the body separated in ways that make it so that if we're damaged, if we have, say, an arrow that goes through one of our lungs, that lung might collapse and we may have an issue within that portion of the body. But because of the compartmentalization of the rest of the body, infection and other issues won't spread as fast. And we may have time to get on top of that with antibiotics and tooling up our immune system to fight the original point of entry because we have these different cavities and separations within the body. So you'll notice the thoracic cavity has quite a few separations. We have the lungs and the heart within this cavity. So if we see the lungs, we think pleura, Pleura. And if we see the heart, then we think cardia. And so around the heart is pericardium. So peri is around. If we see epi, that's above. And if we see endo, that's within, or hypo is beneath. So a few of these prefixes, as we were talking about getting your terminology down and learning a little Latin and Greek, we'll see these prefixes and then we'll see roots. And so these prefixes help us to navigate to where are we at? Are we above? Are we around? Are we within? And then the roots will tell us, is that the heart? Is it cardia? Is it pleura? Is it the lungs? So starting to see those things, you'll see them again, and it will just help you with your recognition. In the abdominal cavity, the digestive viscera, when we see viscera, we associate viscera with organ. And so the organs within the abdomen are covered with this connective tissue that we'll take a look at how specialized the coverings are for all of these items, these organs that move a lot. We need some kind of an anti-friction type of covering for those. And then the pelvic cavity that also houses a number of urinary, reproductive organs, as well as the rectum. So body cavities that contain certain organs help us keep the body from massive movement of infection, and also helps us to create separations between key organs that need to be separated. So within this then, one of the things you'll see within the heart portion, that it's the pericardial portion of the mediastinum, and then there's a superior portion of the mediastinum. So, and you also may hear that pronounced as mediastinum, mediastinum, or mediastinum. It's kind of a tomato thing that you'll see a lot within our learning of the anatomical language that occurs. Around each of these organs, then, that friction reducing component is referred to as a serous membrane. And so this is a thin double layered membrane that's separated by serous fluid. So we have a parietal portion of that and a visceral portion. So remembering that viscera means organ, this is the layer that covers the organ. Then this is going to loop around this covering, and there's going to be a parietal portion. And in between these two layers is serous fluid, which helps reduce friction. So if we imagine that we were able to push our fist into a balloon that was deflated to a point where we could do that, the layer of the balloon against our hand would be the visceral layer. Then it would loop around and have an external parietal layer, and in between would be serous fluid. So this is a really key facet of the way that we function. So many breaths in and out, 100,000 heartbeats per day, so many movements of the intestines, and all of these organs moving, that if we don't have some kind of an anti-friction component, they'll wear themselves out or they'll get damaged. And so this serous membrane is a really beautiful component of our systems that helps us to reduce the amount of friction that we find within these organs. So The particular name for the serous membrane around the heart is the pericardium. And you may have heard of that. If the heart is damaged, say like in a car wreck or something where a vessel starts to bleed, and then it will start to fill the pericardium, we have an issue called cardiac tamponade, where the heart essentially strangles itself because it fills that cavity with fluid. And then the way to correct that is to aspirate off that fluid, say with a syringe, and then restart the heart. So we can also have, if you hear of hemothorax, where we have blood entering into the thorax, or pneumothorax, where we have air entering into the thorax. And so in any of those cases, we've usually compromised this serous membrane, and we're starting to shut off the organs that were contained within it. But in general, if we're not injured, these serous membranes are a key part of helping these organs stay healthy. So the abdominal pelvic regions, we'll take a look at two different ways to look at these regions. One of them will be 9 divisions primarily used by anatomists, and the other will be 4 divisions primarily used by medical personnel. So in this 9 division version, what we see here then is, and it was really cold the day they took this photo. So it's like, can I just, put on a t-shirt or something? But they were like, nope, got to take it this way. So I was like, okay. So here then, if you've heard of hypochondriacs, people that oftentimes express that they feel sick through all kinds of different things, that name was actually taken from this regional area. So hypo being below, whenever we see chondro, we're going to realize that that's cartilage. So we're below the cartilage of the ribs in the left and the right region here. And so a lot of times when people feel sick, they'll hold this region saying that they don't feel well. And that's the association between hypochondria and the hypochondriac region. We have an epigastric region. Epi is above, gastric is digestion. An umbilical region where the umbilicus is, the right and left lumbar regions. So remembering those lower 5 vertebra, having dinner at 5. And then our right iliac region and left iliac, or inguinal. So if you put your hands on your hips, you're probably putting your hands on your ilia. And so each one of those iliac bones, it then becomes a region. The inguinal region is named by by a ligament that goes from our iliac bone to our pubis. And so if you flex your femur, the crease that occurs in between your abdomen and your thigh is the inguinal region. It's where this inguinal ligament passes. And hypogastric, below the stomach, below digestion, or the pubic region. So this is a determination that helps with mostly anatomists to say that, an organ within a certain area within this X quadrant is affected by something. So maybe in a write-up of how a cadaver is looking, or where organs are. Whereas in comparison then, these abdominal quadrants, abdominal pelvic quadrants that are usually used by medical personnel. So when you're in your practice, you'll most likely be writing up notes on patients, and then you can say, in patient expressing pain in the RUQ, assessment preliminarily to be, levels of liver enzymes and different components start to lead us to think that maybe there's some kind of gallbladder issue. And so the key thing to remember with any of these um, divisional components is that they're used to help with identification in write-ups and notes that a patient might have. So if someone was to express pain in the right lower quadrant, we might be concerned maybe about appendicitis. So just getting familiar with which organs are in which quadrant to help you navigate if you ever see a write-up that's using these quadrants. And remember, when we reference anatomy and physiology, we first think about ourselves. So when you look at this image, the right is on your left and the left is on your right. But what you have to do is swing yourself around in space and realize that this is as if you're standing there. So it's actually your right and your left, as if you stood in this position. So if you put your back to the screen right now, you would see that that would be your right and left quadrants, respectively. Some other body cavities that we have a lot of cavities within the body. So within the bones, in particular, we see that we have these cavities that help make the bone lighter while the bone is still very strong. And so, for instance, cavities that we see, the sinuses in the head, we see that those sinuses help give us more timbre to our voice, timbre, and that gives us a nicer resonance while making our head a little bit lighter. So a lot of these cavities then help us to have better function and and great, capacity. Synovial cavities are what we'll take a look at within our joint section. These are the synovial joints are the cavities that we see within our appendicular skeleton for our very movable joints. So within this discussion, we just sort of expanded off of lecture one. Within this lecture two, we're really taking a look at, you know, um, what are the key components of how we communicate better about locations of items within the body, and we'll use these terms quite a lot throughout our practice. Thanks, and have a great day.